The prevalence of diabetes in the urban Indian population is about 20% in the adults. This is much, much higher than what is seen in the Western populations. There are different reasons why people in India have a higher risk of diabetes, and there are many differences in the pattern of diabetes that you see in the Indian population compared to the Western population. First of all, Indians develop diabetes at an earlier age in their life. The average age of onset of diabetes in the American population is about 65 to 70. But the average or the mean age of development of diabetes in the Indian population is 45 years. Who should test for diabetes? If you have a family history of diabetes, especially a first degree family history of diabetes, by which I mean if your father, mother, or elder sibling have diabetes, and if you are above the age of 35, especially if you have obesity, you should check for diabetes. The rates of obesity in India is much lower than the Western population. However, even with the low rates of obesity or low level of obesity, Indians tend to develop diabetes at an early age. One of the reasons for this is because there is what is called abdominal adiposity. It is not only the general amount of fat in the body which determines the risk of diabetes, but also the pattern of distribution of obese fat or fat tissue in the body. If you have a big paunch or a big tummy, we call it in medical terms central adiposity. So if you have a bigger waist at the abdominal area and a big paunch, which is a sign of prosperity, that increases the risk of diabetes than your total body weight. Like if you are a guy sitting in front of the computer for about 8 to 10 hours a day and do not have enough or physical activity at all, that increases your risk of diabetes. So I told you that almost 20% of the population have diabetes in this country, that is in the urban population. And we have also found over the years, the mean age of diabetes is coming down and more younger people are developing diabetes. So in my opinion, there is no cutoff value to go for a checkup for diabetes. If you have a family history of diabetes and if you're obese, please go for a checkup for diabetes.